So you just had a colonoscopy and your doctor told you you have colon polyps? What the heck are those and what do they mean for your health? I'm Dr. Jelliffe, a board-certified pathologist, and I'm here to tell you in 4 minutes or less. First things first, you're going to need your pathology report. If you don't have it, simply ask your doctor for a copy, or some hospitals even have an online portal where you can go and print it off for yourself. It's your right as a patient to have every document and result in your medical record, so empower yourself with all that knowledge so that you know everything about your own health. Once you have your report, find the section that says diagnosis or final diagnosis or results. That's where the important information is. But before we get to your results, let's see what the doctor is actually seeing when he looks inside your colon. Here's the view from inside your colon. You can see that the surface of the colon is pink and smooth. As pathologists, we get to see it even more closely under the microscope. Remember in middle school when you use those test tubes in science class? That's actually what the surface of your colon looks like under the microscope. There's individual glands lined up nice and neat next to each other, just like those old test tubes. Sometimes when your doctor is cruising through your colon, he'll see a small little bump, and this can be what we call a polyp. There are two common types of polyps called adenomas and hyperplastic polyp. Here's where you can go back to your pathology report under the diagnosis and see if you have one of those two types of polyps. Hyperplastic polyps happen when the mucus cells get a little too excited and start to overproduce. There's nowhere for them to go, so they just start piling on top of each other and getting all squished up. They can have an appearance kind of like a saw or a starfish. Thankfully, hyperplastic polyps have no chance of turning into colon cancer. Adenomas come in a couple of different varieties, and you might see it listed on your report as tubular adenoma, tubulovillous adenoma, or possibly even sessile serrated polyp or adenoma. The thing that these all have in common though is that there has been a mutation, and the mutation causes the cells to grow abnormally and the nuclei get darkened and elongated. You can see how dark these test tubes look like compared to the normal test tubes we saw before. Unfortunately, adenomas do have a small chance to turn into colon cancer, so it's really important that you follow up with your doctor, as you'll probably need another colonoscopy in 3 to 5 years. If you see something else on your pathology report, or you have questions about your report, or if you or your loved one have recently been diagnosed with cancer, come and visit us at honestpathology.com to visit with a board-certified pathologist who will look at your case and help you understand your diagnosis. We'll empower you with knowledge so that along with your medical care team, you can make the best decisions for your health care. I'm Dr. Jelliffe, and this has been 4 Minute Path Report. See you next time.